Dr. Brusovanik, what do you do to prevent surgical infections?
That's a good question, because surgical infections are essentially the most fearsome complication. There are a few things. First, I pick patients who don't smoke. I think that smoking increases your chances of infection significantly, and if I'm going to go to war with my patients and take risks together, we should try to minimize those risks. Thereby, I ask all my patients to stop smoking. If an infection happens, you open up the incision, you run a bunch of water through the wound, that should take care of it. But we really have been lucky. We've had 0 infections now in 5 years. So, number one, I clean the skin with one of these brushes, the same brush that I use to clean my hands. In the United States, there's a standard to clean the skin with either betadine or chlorhexidine. I use betadine, then alcohol, then more betadine, then more alcohol, and then chlorhexidine as well. We are supposed to give our patients antibiotics, NSAID. But NSAID is an outdated antibiotics, and in Miami specifically, there's a lot of bacteria that's resistant to NSAID. So I give my patients extra NSAID, and on top of that, I give them vancomycin, very strong antibiotic that essentially is the right antibiotic for bacteria that's resistant to NSAID. We put a sticker on the skin, so as we operate, the part of the skin that's exposed is only the part where we are doing the operation, and meticulous surgical technique. So far so good, we've been lucky, but I'm young. I'm sure that an infection is going to happen, and we'll have to deal with it as with any other complication.